Hi everyone, I am Dr. Pooja Shinde. I am a homeopathic physician practicing in Pune and I also practice in Mumbai and my hometown of Satara. I am happy and excited to announce this brand new online homeopathic series starting from July 5th, 2020, where I will be teaching alongside Dr. Darshan Oswal. My reason behind taking this task of teaching is something very personal to me. To express this, I would like to share how I started my journey in homeopathy. So, in first 2 years of my UG, I had lots and lots of doubts about TSTK. Also, was confused about with how to use repertory. When we take the case, there was a fixed pattern to take the case where patient would not open up. And while asking about his emotions or his mentals, all common symptoms I used to get from every patient. Also did not know what to do with so many remedies and how to read MM from so many different books. So at last, in second year, I joined a homeopath and he taught me one important lesson. That is, to learn homeopathy, you need to practice homeopathy by seeing and taking cases. So I started taking cases whenever I got an opportunity, and along with that, I also learned about the importance of exploring different areas in patient, by which I mean the fears, the dreams, daydreams, his imaginations, his interests and hobbies. And I also learned about focusing on a patient as a whole and not focusing just on the part. So initially when I started taking cases, I came across a case of 54-year male who was hospitalized for liver cirrhosis with type 2 HRS and he had this abscess on his gluteal region which was already drained 3 times by the doctors and he had maggots in it. So the allopathic doctors then had declared this condition of the patient as a hopeless case and had discharged him, telling his relatives that he won't live for more than 2 months. And with such progressive pathology, wherein his blood reports, the serum creatinine, SGPT, SGOT levels were shown very high. So I finally decided to take his case as his relatives insisted me to do so, to give him a homeopathic medicine and help him in whichever way I can. So I went to take his case with lots of fixed ideas in my mind. When I asked him to talk about his illness, he started telling me that he has this condition since last 10 years. And suddenly, he started talking about two incidences in his life which affected him the most. So the case continued for 2 hours, but in those 2 hours, he wasn't concerned about his illness. And he was more concerned about those incidences which had affected him a lot, which did not let him sleep at night. And so he had got very restless mentally and physically. I had got few PQRS where he had this strong craving for fatty food, for spices, and he couldn't pass stools. It was very much difficult for him to pass normal stools. Very little thirst and ulcers in his mouth. Till then, I was sure about what actually had disturbed the patient or the state or his state. So, considering his feeling in the incidences, I had prescribed him with certain remedy, wherein I took what surfaced at that time, which had impacted him the most, which was out of place, which was spontaneous, which was popping out throughout the case. So I was confused at first with the potency, and I ended up giving him what I felt right at that time. To my surprise, after 7 days, after giving him the medicines, the patient was able to eat properly. His ulcers had disappeared and he was able to pass normal stools. Also, he could sleep at night, which was not possible for him earlier. So I was sure that the person was improving as his generals were improving or getting better. After 3 months of the medicine, patient could sit and his abscess was drained and was healing on its own. His ascites and inflammation on the legs was reduced significantly. And to my surprise, the patient survived. So this was a life-changing experience for me in the practice of homeopathy, and also was the best example where different areas of the patient when explored directs us to the correct totality and remedy. So with each case that I took and each case that I saw my seniors take, I got to learn something new each time. And also in this journey, I learned about different aspects of case taking, such as understanding different types of defenses put by the patient, understanding the level of experience of the patient, the genius of the case, and the genius of the remedy. Also, I learned about understanding remedies according to the different natural kingdoms in nature, and so forth. So, as it is said, that in learning you will teach, and in teaching you will learn. So, in this online learning series, I will be sharing my experiences with cases like this and more, and how I was able to overcome each obstacle I came across to become a proud and confident homeopathic physician. So, I look forward to see you all in the webinar. Thank you.